Sexual harassment has implications on organizational performance, workers' well-being and service delivery. For example, it can result into stress, anxiety, sleep disturbances, post-traumatic stress disorder, loss of self-esteem and confidence, among others. In Uganda's health sector, sexual harassment has been a silent problem for long. The Health, Gender, Discrimination and Inequality Analysis Report of 2016 categorizes this behavior and the prevalence of particular forms of sexual harassment. Sexually suggestive gestures were ranked at 30%, sexually explicit discussions and conversations at 24.7%, unwanted attempts of sexual relationships 22.4%, and being the object of sexual jokes, comments and sneering 19.4%.
The female health workers who are the majority victims, and the majority of this type were the female nurses, and their perpetrators were male seniors and employers, supervisors and human resource officers. And we established that the most common type of this harassment that they were experiencing was quid pro quo, this for that, which means that one had to give sexual favors in exchange of employment benefits.
The permanent secretary in the Health Ministry, Dr. Diana Atwine, says cases of harassment are still a challenge in the sector.
There are some that we have referred actually to the Medical Council, and they have reprimanded. There are some, even now, right now, there are some cases that the Medical Council is handling, which we have forwarded them. And one of them, you know, the Kamuli case.
Dr. Atwine says sexual harassment is a major contributor to absenteeism at the workplace.
For example, victims experience depression, demotion, loss of job and income, HIV, unwanted pregnancies, forced marriages.
Despite the existing laws, policies and institutions in place to address sexual harassment, the vice has persisted.
Because this is a silent evil that many people don't want to talk about, even health workers themselves, not just health workers, but all workers at their workplace, especially ladies. They find it very difficult culturally to talk about this.
The guidelines that have been developed include a range of modalities through which reports can now be registered.
We have also put in place reporting mechanism in all the health facilities and the Ministry of Health institutions. Of course, this we have to continue making them understand and really to build confidence so that they are able to report.
We came up with a clear step-by-step reporting system that shows how a victim should be dealt with as and when they report. We also came up with structures that should be reported to, including designating sexual harassment focal point persons at each and every institution at all levels, all the way from national level up to the local government level.
Walter Mwesije, NTV.